Thanks very much, Speaker. My question will be for the Premier, but we all know it's Nurses Week here in Ontario, and I think all of us want to thank nurses for the care they provide us and for caring for the people that we care for most. What is this government doing in tomorrow's budget to ensure that nurses in long-term care homes and hospitals have safe nurse-to-patient ratios?
The Minister of Health.
I'm certainly not going to presuppose what the Minister of Finance is going to announce tomorrow. What I will say is keep listening, because it is a very positive continuation of the work that our government has already done. As I said, 31% increase to the healthcare budget. Why? Because it was ignored by the previous Liberal government. We had a government who was choosing to cut residency seats, medical seats in the province of Ontario. Compare that to what our government has been able to ensure. Not only expanding the number of medical seats in every single medical school across Ontario, but actually opening 2 new in Brampton that is taking on students in September of this year. That is making progress. That is ensuring that we have a made-in-Ontario solution to ensure, as our population ages and grows, we have the healthcare human resources there ready to work.
Supplementary, the Leader of the Third Party.
Speaker, don't tell me how much you're spending. Just tell me what the results are. And the results aren't good. So, many of you know my mom was a nurse for 33 years at National Defence Medical Center. She worked on the floor. I'd pick her up from work often, night shift, overnights, and I knew when they were short because I saw how physically and mentally exhausted she was, and also how late she was for the pickup. Right now in Ontario's long-term care homes and hospitals, they're running short every day. Every day. Just ask any nurse working in one of them. So it's a fairly straightforward question. What is the government going to do in this budget to ensure that those nurses in long-term care and hospitals have safe nurse-to-patient ratios?
Minister of Health.
So, real examples mean that people get service in their community. What does that mean? It means that in February of 2024, we announced 78 new or expanded primary care teams. That means that in 78 communities across Ontario, we have nurse practitioners, we have primary care providers who are providing service right now today. In Innisfil, nurse practitioner-led clinics. In Minto-Mapleton, nurse practitioner-led clinics who are taking on patients and taking that load off to ensure that people have pathways other than just going to an emergency department. I know that we can continue to do better. While Ontario leads Canada, we have an opportunity to train and educate and ultimately hire people in our communities, and that's what we're doing with our primary care expansion. That's what's making an impact in our communities.
Final supplementary, the Leader of the Third Party.
Minister might have missed a piece in the first 2 questions, which is I'm talking about hospitals and long-term care homes, and the fact that they're running short there all the time. Nurses are exhausted, they're tired, they're burning out, and for every 10 nurses this government hires, 6 leave. That's a result that's not good. So I guess the question is, again, is this government going to do anything in this budget to relieve the pressure on nurses by creating safe nurse-to-patient ratios in this budget?
Back to the Minister of Health.
Well, frankly, Speaker, those numbers are not borne out when you talk to the College of Nurses of Ontario. What we see is that we have been able to license over 100,000 nurses in the province of Ontario. We have 30,000 nurses in the province of Ontario who are training right now in the system. What are we doing in our hospital systems? We are upskilling existing primary care and frontline nurses. Why? Because we want to give them opportunities in their communities, in their hospitals, to be able to upskill and be part of a different department. We are ensuring, through working with the College of Universities, to have a learn and stay program that means that people who traditionally have not been able to invest in their education have an opportunity through a learn and stay program where the province of Ontario, the people of Ontario, cover their tuition and their books.
The Leader of the Third Party.
Just for clarification, this question won't be about hospitals or long-term care homes. It'll be about the community. And we know that 2.5 million Ontarians don't have a family doctor. That's 1 in 6. And actually, in the Premier's own riding, it's closer to 1 in 3. That's like a pretty bad result, I think. I mean, how do we get here? So my question, if the minister wants to hear the question, is what is this government doing in this budget to bring nurse practitioners in our community under OHIP?
The Minister of Health.
Speaker, with the greatest of respect, it's a bit rich for a member from the Liberal Party who actually cut medical seats in post-secondary institutions to suggest, how did we get here? Well, how we got here is Ontario leads Canada in the number of primary care practitioners matched to patients.
Leader of the Third Party will come to order.
The
Government House Leader will come to order.
Why?
The Minister of Education will come to order.
When people are attached to a primary care provider, they get better service, and that allows them to continue to stay well and get access. I will say, even though Ontario leads Canada with over a 90% attachment rate, that last 10% is exactly what we are doing, focusing on our primary care action team under the leadership of Dr. Jane Philpott.
Response.
And we've already made an announcement of 78 new primary care multidisciplinary teams last year. We've just closed the application process for this year, and there's more to come in June.
The Leader of the Third Party.
So right now in communities across Ontario, nurse practitioners work in the community. Too many of them are being forced to ask people for their credit card instead of their OHIP card. And we all know it's happening in all our ridings. I know the minister and the premier want to pretend it's not happening. It's happening. So I guess, it would be better if we actually brought those nurse practitioners in the community under OHIP. I think the government can find a way. It might provide a quicker solution than the ones that you're suggesting right now, because look where we ended up. Your solutions so far over 7 years have left 2.5 million Ontarians without a family doctor, and that number is just going to grow. I know you've got a primary care plan, but it's not too ambitious. So, will tomorrow's budget provide the resources necessary to ensure that nurse practitioners working in all of our communities trying to provide primary care will be covered under OHIP?
The Minister of Health.
Only a Liberal could suggest that a $1.8 billion investment in primary care expansion is nothing. We have ensured through our pathway that not only
Member for Don Valley East will come to order.
It's really important to reinforce the last 10% who are looking for that primary care provider, and those multidisciplinary teams, they include doctors, they include nurse practitioners, they include dietitians, mental health workers. Why? Because it is exactly how our healthcare professionals want to work, and it is exactly what patients need, because no matter where you are in your continuum of care, you have a pathway and an opportunity to deal with exactly the appropriate primary care provider, clinician that you need to deal with your existing condition. That's what we do when we expand and we ensure that there is an expansion of primary care, $1.8 billion.
Final supplementary, the Leader of the Third Party.
2.5 million Ontarians don't have a family doctor, don't have access to primary care. And right now, across all of our communities, I would argue probably everyone in this legislature, all of our communities, there are nurse practitioners who are being forced, when they hang out a shingle, to ask people for their credit card instead of their OHIP card. Something that Premier said never happens in Ontario, but seems to be happening more and more and more every day. So part of a simple, quick solution would be just to find a way to support nurse practitioners in the community under OHIP. They're out there. There's lots of them. Why won't the government just simply provide the support that's necessary to allow nurse practitioners to be able to practice in our community under OHIP?
The Minister of Health.
As we expand the opportunities within our communities, we have nurse practitioners working in hospitals. We have nurse practitioners working in long-term care homes. We have nurse practitioners leading nurse practitioner-led clinics in places like Minto Mapleton, in Innisfil. Those absolutely inaccurate. We were the first jurisdiction to actually allow and train nurse practitioners in Ontario across Canada. We lead when it comes to ensuring that multidisciplinary teams, including nurse practitioners, work together to serve that patient, and we will continue to do that work. Because, again, I will remind the Speaker and the member opposite, it is exactly the type of multidisciplinary team that patients and clinicians want. It is the best form of service,
Response.
and we will continue to do that, as opposed to the one-offs that you are referencing.
Question.